Thanks, Kevin. Appreciate it. And thanks to MEA for having myself as well as Carolyn Collins here on the line today, or over the internet, I guess. Um, we're going to talk a little bit today about what's going on in healthcare out-of-pocket expenses. As I say to my family and friends, your scope of what you know gets down to like a very small thing. So we know this. We don't know much of anything else anymore at this point. But we do know what's going on with healthcare and out-of-pocket costs. So the goal here is to educate you today, give you a little bit of understanding of what's out in the market, who the players are, how they're helping you lower the cost of healthcare. And then if we have some time at the end, just talk a little bit about what AblePay does to help in those same lines. So some of this is intuitive, but we'll get into the details a little bit. There's a lot of data here and we have a short time, so these slides will go out. So I wouldn't worry about paying attention to all the numbers we're going to talk about, but we have four real goals to walk through. Is that healthcare costs too much, employees can't afford to pay these out-of-pocket costs right now. They don't understand what some of the simple concepts are of deductibles, co-pays, co-insurance. As a result, providers are losing revenue, and ultimately the patient experience is suffering, right? So out-of-pocket costs, as everybody knows, continues to rise year after year because the premiums rise, and as employers, it's very difficult to continue to support the premium costs without making adjustments to your out-of-pocket healthcare expenses. So here's some stats on the premiums. You can see the average cost for annual premiums in 2020 for employer-sponsored plans. It's almost $7,500 for single and $21,000 for family. The average contribution of the cost is split 17% for single, 27% for family. And over the last 5 years and 10 years, the average premium cost for family continues to grow as well. From a deductible standpoint, the average annual deductible for employees with single coverage is now up to $1,600. And the average cost for coverage overall gets to, it's a little bit different for single for 13. 79% of the increase, there's a 79% increase in single annual deductible costs over the last 10 years. And there's a 111%, let's move this here, dollar increase over the average annual deductible for single coverage since 2010. As a result, employees can't afford to pay, right? So most simply just don't have the means, but it's the average out-of-pocket cost continues to grow and outpace both workers' wages and inflation over that period of time. So we say, no money equals more problems. So 63% can't afford an unexpected bill of $500. 69% have less than $1,000 in savings at home. 15% go uninsured because of the cost. 41%, which is a huge number, are currently paying off some sort of medical debt in the country. It's the most common reason for bankruptcy in the US right now as well. So not only do they not have the money, but they really don't understand, despite all our efforts to try to educate employees on healthcare and how to use their plans and what is the intricate aspects of their plans. 52% have limited to no health insurance literacy at all. So it's really complicated. And we found this is the biggest reason why people don't pay their bills, in addition to the fact that they don't have the money. So what we do at AblePay is really educate them on what's transpired, make sure the bill's right, and make it easy to pay. And ultimately, people do. But it's complicated. So insured customers have difficulty navigating the system. You don't know what the price is going to be up front, and higher costs are certainly there's not a connection to higher quality for healthcare expenses. So 41% are surprised about how expensive their bills were after the fact. Only 47% really understand what procedures are covered, what constitutes the in or out of network care and that process of a network and how it works. And 52% said figuring out what counts towards their deductible is a struggle as well. So you can see the percentages here. Only 52%, right? So 48% of people didn't know what a copay was. certainly not an out-of-pocket maximum. And for those on the call with health savings accounts and FSAs, 62% don't really even know what those things are. So if you take that back and we talk internally about the, passing the buck in the healthcare cycle overall, right? But ultimately, if you can't afford the bill and you don't know how to pay it, this ends up falling on the provider. So they're losing revenue from a provider perspective, right? So the national rates on collections are 17 to 35 cents on a dollar. For out-of-pocket healthcare expenses in Pennsylvania and Eastern Pennsylvania, whereas most of our provider network is, it's about 40 cents on a dollar. And I know there's a lot of people on the call that would say, well, I always pay my bill, right? But there's a lot of people that don't, right? And there's ways to try to help providers collect those bills, but it's very difficult going for them right now, right? So 30% of all of the healthcare bill now comes from the patient's pocket. So gone are the days of just paying a copay and having your service, right? There's this whole collection process on the front end, which is kind of a customer service nightmare, and then collections on the back end, which really you do a good job taking care of patients, and then you send them bills. And at that point, it starts to ruin the patient experience overall. So the net effect, you can see 68% of hospital bills under $500 aren't paid. 72% of hospitals say this debt collection process is their biggest worry. 77% of patients do not pay within a month. 74% report an increase in patient responsibility over the last few years. And 70% of providers say it takes at least 30 days. It's typically 90 days to collect on past due accounts. So here's the figure we discussed on the collection rate from the provider's perspective. And then this trickles down in the patient experience. So the last thing a patient receives is a bill, right? And that really starts the decline in the patient satisfaction. I'm sure if we did a raise of hands on this call, how many people just get the first one and wait and get the second one and wait and get the third one, hopefully that the insurance picks it up. It's so confusing. It's one of the most confusing things we all deal with on a regular basis is a healthcare bill. So it's difficult to navigate the process overall. And quite honestly, to be sure you even owe the money that they're requesting of you, right? So there's a 30% decrease in satisfaction between discharge and the billing process. People will switch providers for a better experience. People want to pay all their bills in one place. They're confused on EOBs and they want customized payment plans. So we talk about the convenience gap here. So you got to make it easy for people to pay, and it's not right now. So 65% of people would download a mobile app and actually pay their bills that way. On the bottom here, 69% of those with medical bills shop around and price. It's difficult to learn how much you really owe, and that's kind of a function of just the way you have procedures, right? So I had a knee arthroscopy now two months ago. When you plan on having a medial meniscectomy, but it ends up being also a debridement, and maybe it's a lateral meniscectomy too. Those codes get added onto the bill, and it will change the rate, not only that the insurance owes, but also you as an individual as well. So it's very confusing, and it's difficult to try to anticipate what the cost is going to be upfront. We talked about people switching providers for better experience with the payments, and 67% of those who tried to negotiate said that they were unsuccessful on their own. In addition to the convenience gap, there's also an information gap. So only 20% of people, 80% don't trust the bill. So only 20% of people do. 72% of consumers are confused of what an EOB is. 35% of all medical bills contain some sort of error. And people want to know what the cost is up front, which is very difficult to do. So employees should be able to change their payment structures at any time. So you want to have some payment flexibility. We still don't know what the cost is going to be up front. You want financing needs without really any penalty or interest costs. So the goal here for all of us is really to lower the cost of healthcare, not increase the cost of healthcare with interest, just because you don't have the money at the time of service, right? you want that flexibility over time to pay your bill. Maybe this month you have the money, next month you don't, so you need some flexibility on how to pay your bills. So how are employers attempting to control these costs? And many of these, names or acronyms I'm sure you're familiar with. So high deductible health plan. So there's pluses and minuses with high deductible health plans. The more costs we're putting on employees, unfortunately, they're not in a position to pay for those services, at least at the time of service. Health reimbursement accounts. So it reduces the burden from an employer's perspective, reduces the burden on the employee from an out-of-pocket cost. It helps to lower premiums, but the employer is not saving any money on those bills on the out-of-pocket side. Payment plans, benefit negotiations, supplemental insurance like secondaries, gap plans, AFLAC to support those people when they actually do run into a problem. Most people have wellness programs in place. There's incentives to try to get healthier, right? So we have a program called Prod Health here that we work with to help our employees stay healthy and actually incent them to lower their cost of healthcare for both of us. Third-party programs, you may have heard of GoodRx or Care Credit that creates some financing. There's other programs in the hospital systems like Cedar and Patient Co. that really try to make it more flexible to pay for the services. And if you do make it flexible, it is easier to pay, and the hospitals will actually collect more money in that case. Education, trying to help people understand what copays, deductibles, coinsurance is, and then kind of point of service. It's cheaper to go to urgent care than it is to go to the hospital, or it's cheaper to use telehealth services or go to urgent care. So those types of choices, which can lower the cost of healthcare for all of us. So how does AblePay work and address this problem, right? So you can read through the paragraph here, but on a high level, we're a unique model that really joins the provider, the employer, and the employees that ultimately become patients into the process overall. So because hospitals are only collecting, say, 40 cents on a dollar, AblePay is paying them much more, closer to 70 cents on a dollar, and we're guaranteeing that money. So the thesis for AblePay is that we do think that people do want to pay their bills, and we've proven that out. So we actually guarantee the payment to the provider and then work with your employees to give them flexibility to pay over time. So to walk through an example quick on a $1,000, it's called the $10,000 surgery that I had at Penn, right? So you present your insurance card and you present your AblePay card as a secondary. The bill goes out to your insurance. Let's call it Independence Blue Cross. It gets processed. So the $10,000 becomes a $5,000 allowable. $5,000 is written off because of the contractual relationship between IBC and Penn. And let's say I have a $1,000 deductible. So $4,000 is still paid to Penn. That $1,000 comes to AblePay as a secondary instead of you directly as a consumer. So no more patient statements at your house, no more provider, chasing you down for the money. And then you're coming into AblePay and you're deciding how you want to pay your bills here, which probably the easiest way is to just show you this. So right from our website, you go to Enroll Now, you go into the enrollment experience. You can put anyone you want on your account. It's not tied to your insurance plan. We're going to ask you some questions on how to your current billing experience, on the ease of understanding your bill, timely response to questions or concerns, or the overall satisfaction with the billing process. You're going to put your information in, simple demographic information into AblePay so we know who you are. And then Mary can add anyone she wants to her account. So typically her spouse and kids, but also grandparents or parents you can add on your account as well. And then choose a default payment term. So this is what you start with. So whatever you're comfortable, 1, 3, 6, or 12 months, you can see the discount declines over a period of time. So you get a 13% discount if you can pay in full. So on a $1,000 bill, you pay AblePay $870, we pay Penn $700, AblePay makes $170. That's the only way that we create revenue. and then you save $130, but the 1,000 still goes towards your deductible. Or if you don't have the money, you can pay over 3, 6, or 12 months. And for those people that can't afford to pay within 12 months, we do extend terms beyond 12 months as well, especially during this difficult time with COVID. You put in your payment method. So your HSA, your FSA, it's great, pre-tax savings to use this money, and then you get a discount on it as well. Your credit card, your bank account, whatever you're comfortable with to putting in to make payments through us. And then you sign off on legal, and then you are in. Once we confirm that it's you, submit the application. And then once you're in, you have a bill. You get a text message, says, hey, John, go onto the portal. You have a bill. Mary's got 3 here. One's for $95. So you can check out the bill here. And people really sign up with AblePay for a couple different reasons. One, they want the savings. They want savings over time. They want an advocate, so someone that can really support them, ask any questions you have regarding your bill. And then we make it super easy to pay with the portal. So when you put those ingredients together, we really change behavior on how to pay bills. And ultimately, people do want to pay their bills. It's just very confusing and kind of convoluted process right now. So Mary can pay this bill over one payment, or she could switch to her house savings account, take advantage of the 13% discount, pay the bill. It's a bigger bill, pay this over 6 months, $161 a month. Tomorrow, and then 5 more times every 30 days. Even a bigger bill here, pay this one over 12 months. So if you have a health savings account, you could take $227 out of your account and then put it into your, out of your paycheck, put it into your health savings account, and then we could take the money for a period of time. All your in-process claims are here. You can pay off early, you can extend terms. Finalized bills are here for your convenience. So you have those. You can have your history of your payments. You can change your account and pay everything over 6 months, right? Or 12 months. Put in new payment methods, add additional members to your account. We have a list of your communication between us, participating providers, and frequently asked questions as well. So with that, hopefully we educated you a little bit on what's going on out there in the market, and then how we're different and how we help your employees navigate this process overall. But we'll open it up for questions at this time.
Thanks, John. I was taking a look at the chat, and we got some nice comments from some users of AblePay. Thanks, Garrick Weaver and Karen Goldman. I haven't seen any specific questions yet. Let's see if one just came in. Here's a question. This is great. Is it available in Spanish?
Yes, Kathy, I see a question there. So we have Spanish materials. The portal is not yet in Spanish, but I would say that's probably going to be updated in the next 2 months. The other question, I can see them here, Carolyn, too. Okay. So, as far as can employees on Medicare use it? Yes, they can. So it doesn't matter what the payer is, Medicare, Medicaid, commercial insurance, it doesn't matter. Anyone can sign up for AblePay. And I didn't mention before, but if it wasn't stated previously, AblePay is free to the employer and the employee. The only way that we create revenue is when somebody uses the program. As far as participating providers, we have a lot of smaller ones in Philadelphia, but also bigger ones. Penn Medicine is in the program. Mainline Health is in the program. And we are actually wrapping up, I guess I could say this in prime time now, but we're wrapping up our agreement with Independence Blue Cross. So it's going to be rolled out to all small group and consumer this summer. So hot off the presses.
Any Delaware providers?
No, not at this time yet. We're getting pretty close to Christiana, though, and I would expect that within the next few months.
Does it work with an HRA plan?
Yes, it does. In fact, we have a really interesting HRA model. We didn't build AblePay specifically for HRAs, but we figured out pretty early that we were in a unique position to make the HRA process much better. We have some pretty big clients right now. So The benefits of the HRA with AblePay versus a standard HRA is that one, you don't have to, an employee does not have to front the money, right? Because the claims are going to come to us directly. They don't have to get reimbursed because they never fronted the money. And then the employer can also get a 13% savings on the bill, right? So on a $2,000 deductible, if you have a first $1,000 on the employee, a second $1,000 on the employer, the employer can save 13% on that $1,000 as well.
Do you need to have all employees sign up or just as wanted?
Just the ones that want to sign up. There's no minimum requirements. We're trying to help as many people as we can overall. I just wanted to make a note too, as far as the network. So that's guaranteed at Penn and at Mainline and some of the other providers you can see on the website. But that doesn't mean that we cannot save you at other providers. So say take at Jefferson Health, we've been getting a discount there for a long period of time, even though we don't have a contract. So we do negotiate those claims, even if they're not part of the AblePay network, and we're successful about 75% of the time. It also serves as a marketing piece, right? The more cards that come in, the more they see AblePay, and the more likely they'll come on board as part of the network.
Does AblePay work with all insurances?
It does, yes. So we'll work as a secondary post service for all insurances. And I see the question from New Jersey. We do have New Jersey providers with some of our crossover. So obviously Penn is in New Jersey, St. Luke's is in New Jersey, and we're getting pretty close to both Virtua and Cooper as well. So I would expect that again in the next couple months.
A lot of people may not realize that Princeton Hospital is part of Penn Medicine too, in New Jersey.
This has been great, guys. I think you see that there's a lot of interest. We've been using it at MEA. What's great is it's super easy on employees to set up the administration, and I love that it's giving people flexibility and control over the expense, and that ease of use of having all your bills come to one place has really been nice. So thank you very much. As I mentioned in the beginning, AblePay is a partner of ours. So if anyone that's an MEA member wants to learn more, you can reach out to our member team, Matt Rossler. You can give him a shout out and he can connect you with Carolyn and talk about the process, or talk to other members that are using it. We've had a lot of people sign up with AblePay since we started this just a couple months ago. So John and Carolyn, thank you very much. That was great. And again, thanks for the questions. Great questions from everybody.
Thanks, Kevin.
Thank you, Kevin.
Take care. All right, so we are going to turn it over to Amy to talk about all the new stuff coming out of the CDC and everything else. Amy?
All right, thank you, Kevin. Thanks, John and Carolyn. That was great. So a lot of stuff going on, right?